A very good evening to one and all. Ladies and gentlemen, let me first of all wish you a very happy new year. And I hope this year will be much more prosperity will follow you this year, much more. Ladies and gentlemen, today we have gathered here as an introduction for an introduction session on the new course by Pradigna on Uttravasti. And ladies and gentlemen, this is the first time that such a course is ever happening. So without further ado, let me introduce a, topic. So yeah, this course is going to be done by two experts in this field. We have Dr. Bharadas Narendra and Dr. Pratibha CK. This is going to be a 4-day course. It is going to be short, 4-day course only, 8 hours, 2 hours per day. Access to recordings will be there. And the video tutorials and demonstrations on Uttravasti by the experts will also be there during this class. Uttravasti practice as OPD basis, and they'll give you a basic idea of I'll let them introduce the topics and I'll just give you a basic idea of this, how this is going to be. We will be providing certificates for this course also. So uh, just want to tell you about another course that is coming up. It is an advanced course on cosmetology. We'll be including aromatherapy, SOPs, and product making in cosmetology and trichology in Ayurveda. So if your friends or family or anyone is interested, please do let them know about this course also. So you all know how to reach us. It is www.pradigna.com, and email is pradigna@gmail.com. So there are few guidelines that I'll just go through. It is not required as of now as an introductory session. We'll be having some roll number system where you'll be able to get how you can get into the room. We'll be having a WhatsApp group dedicated to for helping you practice this procedure. So the experts will also be there, the teachers will also be there in that group, and you will be able to ask questions later on. If when you start practicing, you'll have you'll start having doubts about how things are done, and they'll be able to hold your hand and help you do that procedure in the future. And there are few regulations and policies that we'll be following, which I can get into later. I'll just go directly to the teachers because they are the ones who are going to introduce the topics. So let me first call upon Dr. Pratibha CK. So before I hand it over to Dr. Pratibha, let me just give you a brief introduction of Dr. Pratibha. Dr. Pratibha CK, Professor, Department of Panchakarma, Amrita School of Ayurveda, did a BMS from KVG Ayurveda Medical College, MD from SDM College of Ayurveda, PhD ongoing at Utkal University, an academic experience of 13 years of undergraduate teaching and 8 years of postgraduate teaching, authored a book titled Shodhaniya Siddhi, published by Chaukampa Orientalia Varanasi in February 2015, awardee of Vagbhata Puraskaram, awarded at National Conference on Panchakarma Vagbhata Sarani, Todupuzha, December 2006, and appreciated by Amrita Vidyapidam during the year 2014 to 2015. Published about 22 articles and conducted many guest lectures and TV programs. She always were a supporter of all the programs that we were conducting. So without further ado, let me call upon Dr. Pratibha CK for introducing the topic. Hello, ma'am. Hello.
Yes.
Yes, ma'am. Happy New Year, ma'am.
Thank you.
Over to you. Over to you.
Okay. Can you see the screen?
Hello.
Yeah. I have
Uh,
shared my screen.
I'm not able to see it here. Dr. Rahul, is it visible?
Yes, yes, it is visible.
Okay,
It is
okay,
visible.
man. Please, yeah, please go ahead.
Okay, thank you. Uh, Namaste to one and all present here. Uh, so, as Dr. Sham has told, the next course that is being conducted is on Uttara Basti, both male and female Uttara Basti. So, as I have written here, past, present, and future. So, we will be dealing, whatever we will be dealing here will be past, present, and future of Uttara Basti. So, what was there in the past, and what we are practicing presently, and what its future will be. So, this is what we are going to be explaining in this future sessions. Before that, I would like to thank the organizers for giving me the opportunity to be a part of this course. Uh, Actually, my love for Basti and Uttar Basti started in my UG career. So, not UG, PG. So, when I went to PG, uh, so Basti, as you know, it is told as Ardha Chikitsa, uh, and if you okay, Basti, as you say, it is Ardha Chikitsa. We know that why Basti is called as Ardha Chikitsa, because its path, its movement in the different parts of Vata, Pitta, Kapha, Rakta, anything, and all the systems of our body. So that is why it is called as Ardha Chikitsa. And if you see, it takes very less time to get the result, unlike Vamana and Virechana. And you can give different medicines. Different medicines can be given in Basti. Whereas in Vamana and Virechana, you have only one drug with this Vamana or which drug Virechana. Not one, maybe 10, 12 drugs. But it is not like that for Basti. Where you want the action, you can give the medicine. So such medicines can be selected and given in Basti. So if you say Basti as Ardha Chikitsa to the Sarvanga diseases, I will call Uttara Basti as Ardha Chikitsa in urogenital and reproductive diseases. So this is what is Uttara Basti. So if you take any disease of urinary system, genital or reproductive disorders, you will end up in the Chikitsa principle told in the classics will end up in Uttara Basti. So it is an ultimate treatment for many of the diseases related to urogenital systems. Maybe people uh, like if I tell you that I will be dealing mainly on female Uttarabasti. So in olden days, females were given very less importance, and similarly was the importance given to Uttarabasti also, because when we tell about Basti, we commonly concentrate on Niruha and Anuvasana, not Uttarabasti, because it is explained last. And if you take any reference in Uttarabasti, they will tell it is similar to Anuvasana Basti. So we will not get clear cut things in classics about Uttarabasti. But when you go to practice, things become more and more clear. When you actually do the Uttarabasti, the obstacles, and you actually understand how easily Uttarabasti can be performed. How you can understand the Samprapti Vighatana of a disease. So Uttarasti is a very simple and humble treatment for many of the diseases of this urogenital system. That is why I call this Uttara Basti as Ardha Chikitsa for these diseases. As you know, Uttara, the word meaning of Uttara is answer. It is an answer to many of the disease. Moreover, it is anapayi also, doesn't produce much complications. If you see the brochures, there was a brochure with the shocking complication, vasovagal shock. Eh? So very rare. Don't expect such a complication in Uttarabasti. Very, 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 very rarely you will find such a complication of vasovagal shock in Uttarabasti. So don't be panic. You can easily practice and understand Uttarabasti. So common, it is like commonly Ayurveda people get cases of very chronic cases of urinary and other reproductive system disorders. It will be usually chronic. You won't get the patient in the acute condition because they will go to modern hospital, and when they come to you, it will be a bahudosha avastha. So it is very difficult to treat with shamanaushadhi. So when a patient which is not acute, which is a chronic condition, when it comes to you, it will be in a very chronic avastha. It will not be acute. Very rarely you get an acute case. Commonly you get a very chronic case. So like urinary incontinence, chronic UTI, cystitis, bladder collapse, or lot of cases of infertility because of various reasons. And some of the local diseases like vaginal infection, cervicitis, endometrial hypo or hyperplasia, tubal blocks, and ovulations. So these are the common conditions which you encounter in your clinical practice. Actually, we encounter in our clinical practice. So when they come to you, it becomes a bahudosha avastha. That is why it is very difficult to treat with a shamanaushadhi. You need to go for a procedure. That is a must. That is why many times it becomes too late for us to get the result. With shamanaushadhi, you will get the result, but it will take longer time. But when you give Uttaravasti, you will get the result very fast. So that is why Uttarabasti becomes the Ardha Chikitsa in most of these disorders. Never think that it is a treatment for a local disease only. It has systemic effect also. It moves, it can change the hormonal levels, it can act till the brain, it can act through the nervous system. So, like all the other Panchakarma procedures, uh, which not only works by drug absorption, it works with stimulation. It stimulates the system. That is how it corrects the system. So that is why, moreover, this Uttaravasti is not only a Brahmana or absorptive mechanism. Not only the absorptive mechanism is there, it also has a Shodhana effect, cleansing effect is also there. So both the effect can be seen with a single treatment, which is not possible in any other Shastra. So we should be very grateful to our Shastrajnas because they have found out such a wonderful treatment. Moreover, it is because in olden days there were Navadwaras, and through all the Dwaras they used to put some of the other medications. These were all the different routes of drug administration for them. So the one Dwara through urine, urethra and even vagina, even those Dwaras they did not leave, and they put medicine through that Dwaras also. So this Uttarabasti is a route of drug administration, not only like mouth, nose, eyes, etc. Even urethra and vagina was taken up as the route of drug administration, and that is how the Uttarabasti was developed by our ancient acharyas. So, in this course, we'll be dealing on applied anatomy and physiology of the female uh, reproductive system and genital system and the urinary system also. We will also be dealing on the importance and utility. Don't think that it will be a totally a theoretical class. It will be more of practical utility and things will be like that. Both contraindications and indications will be dealt because indications are more important according to Ayurveda. If you see all the texts, the contraindications are explained first. Then only indications are explained. So that is why contraindications are very, very important. Procedures, old, our textual procedures versus new procedures. New means what we adopt. There are various different ways how we can adopt this Uttaravasti procedure in a very, very simple way with minimal finance because a Uttarbasti will not cost for a doctor not cost more than 200 rupees. Within 200 rupees, you can do a Uttarbasti, and you will get lot of satisfaction after the a course of Uttarbasti. So the price I have told is for 1 day. 1 day it will cost around 200 250 rupees based on the type of instrument you take. Then recent trends and developments in Uttaravasti will also be done. And we will also deal in detail about the complications and what we have to do. In simple ways, you can prevent a lot of complications. And if complication arises, what you have to do also. Video demonstrations will be there. And question answers session will be continuing it. And if you see Dakshastirthartha Shastrartho Drishtakarma Shuchirtisha. So this is the Vaidya Lakshana. And Daksha, I know all of you will be Dakshas only. Able. Drishtakarmata. There may be a small lack of Drishtakarmata. And if you see the Yajjapurishiya Adhyaya of Charaka Samhita, he says, Drishtakarmata Nissamshaya Karana. So the Shrestata of Drishtakarmata is Nissamshaya Karana. So that is what you are going to get it in this. And Asamarthata Bhayakarana. So you will be removing your Bhaya and we will be improving your Nissamshaya. So you will not have any doubt. So whether to do it or not, whether to take this drug or not, that will be the your uh, that is what we are going to give you. And with the discussions, what we are going to have will be Tadvidya Sambhasha Buddhivardhanana. Surely, we both, you and me, everybody, we all will be have Buddhivardhana, which we don't have. So finally, with all these things, we are going to improve our system of science, our system of science of Ayurveda, Amritana. Okay. So finally, I would like to conclude by saying that Kwachid Dharmaha, Kwachid Maitri, Kwachid Arthaha, Kwachid Yashaha, Karmabhyasaha, Kwachid Cheti, Chikitsa, Nasti Nishphala. So Chikitsa never goes unfertile because either you will get dharma or maitri or artha or yasha or at least your practice, and the chikitsa will never become nishphala. So I will surely tell you that uh, dharma, a doctor's dharma, anyway we are going to fulfill. Maitri, I think all the doctors will be very much friendly with their patients. Artha and Yasha will surely be with you along with your practice. So please do, if you have, if you really want the classes, you can join and join the Pratigna team. Thank you. Thank you.
Thank you, Dr. Pratibha. Well said. Excellent, excellent. Thank you for the introducing the topic that you will be taking. Now we'll go to the next, teacher who's Dr. Bharat Narendra. So before I hand it over to him, there are some chats in the chat group. We have posted some. Dr. Rahul is posting some links to WhatsApp groups. If you are interested in knowing more about this course, please do click on that and join that WhatsApp group, and we'll be posting all details about these classes in that group. So you'll get to know more about this if you are interested. Please send that link to your friends also and your colleagues who are interested in this, especially students, because a lot of students are not able to see these kind of procedures during their course, the BMS course. So this will help them improve. The course fee that we are planning to have for this is 999 rupees for 4 days course, and this will be beneficial for all the people who are planning a career in Ayurveda. Now we'll go to the next speaker. I don't want to keep him waiting. Dr. Bharat Narendra, Bharat Narendra, BMS, MD, PhD, Associate Professor and Head of Department of Roganidana Department, Sri Jayendra Ayurveda College and Hospital, Chennai. His research interest is in the field of infertility. He has done his PhD in infertility, devised a new Arohana Matra Basti technique, and has standardized 3 symptoms in male factor infertility. He takes care of regular Kaya Chikitsa OPD, Department of Sri Jayendra Ayurveda College Hospital, Nasratpet, owns 2 clinics at the heart of Chennai called the Bharat Clinic and Vibha Clinic Center. His clinic has performed more than 4,000 Uttaravastis. He has been practicing at various hospitals and clinics under Dr. Asif Ali's Panchakarma Hospital, Karnataka, and formerly worked with Dharma Ayurveda Medical College and Hospital from 2011, joined SJSAC in the fall of 2013, participated in over 50 Ayurveda conferences and workshops, owns a well-acclaimed YouTube channel named Ask for Ayurveda, where he regularly gives talks to general public on ailments that can be cured through Ayurveda. And he has been, he is actually my classmate and my friend. I don't want to keep him waiting after this. So over to you, Dr. Bharat. Please introduce the topics that you'll be taking for us in Pratigna. Over to you.
Namaskaram.
Yeah.
Thank you, Shyam. Thank you, Team Pratigna. It's a wonderful
The
thing to
slide,
associate with you.
Dr. Pratibha, can you please? Yeah, the slide is still on, I think.
Oh,
No problem, no problem, no problem. I'll see.
First of all, I thank my close friend, Dr. Shyam Mohan, and his team, Pratigna team, for giving me this opportunity. This is a great opportunity for all of you, actually, to understand what Uttravasti can give you. Most of us, including me, when we were students, we used to be actually a little bit even afraid of Uttravasti. Till I finished my UG, it is I'm ashamed to say that I didn't do even one Uttravasti. But once I joined my PGIs in Karnataka, I saw many people, practicing Avastis and Uttravastis right and left. I also saw other type of practices, all of the practice. Everybody had their own way of practicing. So I wanted to develop my own way of practicing. We are 3 generation doctors. I don't know before that how many were there. So I know 3 people, including me. We have been an infertility specialist family. We take care of all infertility cases. Most of the cases are complicated when they come to us. Usually when people come to Ayurveda, they think after every other single medical system has failed them, they think Ayurveda can save them. I don't understand the logic in it. However, they can come to Ayurveda at first. If you know that after modern medicine and other systems fail you, if Ayurveda can save you, obviously Ayurveda can save you. Right? So what happened was when I wanted to have my own style of practice, when I wanted to have something unique, because I'm in a city like Chennai, where there is an Ayurvedic doctor almost in every corner. There is an allopathic doctor, at least 4 or 5 doctors in every street. So you need to have your own practice if you have to survive. It's a game of survival. So you have to be the fittest in order to survive. And so why I'm trying to say all these things is that uh, what I got with a lot of difficulty over a period of 3 years, 4 years of hard practice, we'll be able to tell you how you will be able to use this, not only Uttravasti, the infertility practice as such, urogenital disorders also come under the same Uttravasti practice. Uh, and we'll be able to tell you how you can use this Uttravasti to your own good also, both practice-wise, result-wise, financially. Also, it is a good thing, and obviously the patient gets immediate results. Fertility today, in my last 2 talks, if you would have heard, it's becoming a pandemic. Every year in India alone, we have more than 1 crore couples coming for fertility treatment. That is only the recorded. There is definitely more scope. Okay. So, and especially in the metro cities, this is definitely increasing. And day by day, these cases are increasing. What I did was, because ours is an infertility practice, I wanted to do something special in my practice, what my mother is not doing, what my grandmother was not doing, what my father was not doing. Uttravasti was one area where they didn't touch much. So I wanted something new. So when I started, I was very afraid. Then I started studying. When we went through the material, I understood that all infertility problems come under Apanasthanagata Vikaras. Obviously, right? Shroni Vasti Medra Urugochara, right? Apana Apanagara, Shroni Vasti Medra Urugochara. And I also came to understand that when Acharya says Shukra Artava Shakrita Mutra Garbha Nishkramana Kriya, continuously when a person withholds, Veghan Nadare, he says, when he withholds, because I'm talking about male infertility, I'm going to say he, when he withholds Shakrit and Mutra, it also affects his Shukra. And same thing goes in women, it affects the Artho. This is what I started understanding when I started taking Nidana. Documentation is one of the most important parts of practice. And being a Nidana person, I'm a Roga Nidana person, I'm very much interested in recording the symptoms, various levels of each symptoms, gradation of each symptoms, appearance of new symptoms. What is the importance of appearance of new symptoms and what is the importance of disappearance of symptoms? For example, in gallbladder stone, when there is excruciating pain, suddenly if the pain vanishes, you should not be happy. You should actually be alarmed. Right? We should definitely be alarmed. Maybe the gallbladder has ruptured, something like that. Even when it comes to infertility, there are many things that you'll have to see when it comes to Roga Nidana point of view. So when I knew that this is an Apana Sthanagata Vikara, obviously I went for Vastis initially. When I went for Vastis initially, yes, there was result. I will not say no. Definitely there was result. But nothing like Uttravasti. Once I started practicing Uttravasti, to be really frank, the first time I practiced a male Uttravasti was after seeing a YouTube video. There was nobody to teach me properly. In my area, there was nobody to teach me properly. I had to travel somewhere else and learn. So first I saw a YouTube video and I wanted to do something which was not going to hurt the patient. So I started with a very easy thing, which again, that was my own this thing. After seeing the video, I formulated my own way of giving Uttravasti in the urethra alone. That is an intra-urethral Uttravasti. It had tremendous results. The patient was actually responding really well. So I then started doing Uttravastis again with intra-prostatic and then intravesicular. That is, I started getting deep into the urinary tract and started giving Uttravastis, and I started seeing better results. Then I started understanding about how this Pratyagamana affects the patients, this thing, how you can give more dose. For example, Uttravasti, most of the people, they stop with 5 ml. Some people even start with 1 ml, half an ml, or all that. In male Uttravasti, very easily I give anywhere between 25 to 30 ml dose. There are some things that you don't have to be afraid about when it comes to Uttravasti, like how ma'am was talking about, like what she was talking about. Exactly, you don't have to worry about this Uttravasti at all. That's what we are here to tell you. You don't have to waste 4 years like me. You can start doing your practice right away. Okay, maybe after this course will enable you to give Uttravastis in most common conditions which a person faces when he or she is practicing fertility. When you're when you're having a fertility practice, you will have to treat recurrent urinary tract infections, urethral strictures in men, prostatitis, vas deferens infections, chronic cystitis, epididymal infections or epididymal cysts, varicocele, orchitis, olivastenoteratozoospermia, azoospermia, prameum, and then other like premature ejaculation, unejaculation, delayed ejaculation. There are also other conditions like erectile dysfunctions. What we'll be trying to do is to see which type of Uttravastis will be helping in which persons. Not in all people, intravesicular Uttravasti will be useful in men. The same way, and we are also here to tell you that you can do this in a OPD basis. You don't have to worry about having a hospital setup and all that. We use sterile equipment, and excellently you will be able to practice this. And there are 3 types of Uttravastis that I very regularly practice: intravesicular, intraprostatic, and intrauterine. We'll be talking about that also. And again, like how ma'am told, this cleanses the whole reproductive pathway. It cleanses the seminal pathway right from the seminiferous tubules till the external urethra. So the distal part of the urethra. So what happens is this is a one-stop solution for infertility. So you will be able to use this Uttravasti day in and day out. Even during this Corona period, every year we used to finish at least 500 Uttravastis. Even during this Corona time, we have finished 200 Uttravastis this year. So you can imagine how much of Uttravasti I'll be using in my practice. And once I started using this in infertility, I also understood that this can be used in sometimes in back pain, many a times when it comes to sacroiliitis and in also some L4, L5, S1 disc prolapses. All you have to do is also read a lot of modern anatomy. You will understand that the same innervations which innervates the urinary bladder, the Shroni, Vasti, Medra, and Uru, is the same thing which comes from the L4 to S1 or S3 maximum. So all these places are actually nourished by Uttravasti, and all these problems can be treated. And we have even tried in one interesting case in appendicitis, we tried one Chandanadi Taila with Dharmatram Taila Uttravasti, and we got immediate result. Immediate result. Within 5 minutes, the severe pain in appendicitis subsided. So these are kind of miraculous effects that you can get, that you can give. We have tried leech therapy also in appendicitis. Of course, that's a different issue. I'll try to stay focused and not digress. However, we'll also be teaching you how to select your medicines based on gunas. This we have talked about in PTSR and in infertility talks also, but I will definitely want to repeat it here, because if there are some new persons, new students, even if there is a one new student, they'll be able to understand this method, which I usually follow to select medicine for any roga. That same module I put it in infertility also, and why we get results when we use that module, and the special medicines for special problems. That is, especially for urethral stricture, I use Brahmigrita. Why do I use Brahmigrita? This is what we'll be talking about in the second part of the class. class. And then I will also be giving you some examples where there was tremendous results, like one grade 4 varicocele. After giving 3 Uttravastis, one side varicocele has vanished, right side. Left side, there is grade 1 varicocele. After 3 Uttravastis, that is 3 courses of 5 days, again 3 days and 3 days. So these are the things that we'll be talking about here. We'll be giving you live, not live, we'll be giving you video demonstrations also. So you will definitely gain from this talk, from this course, and it is very, very important to have your own identity, especially when you're practicing in, let it be a rural place or an urban place, when you're having your own style of practice, when you have your own speciality, then people come to you from all corners of the world. Like I told you, this the fertility thing has immense scope. So definitely you'll be getting at least 4 to 5 cases per day once you start practicing regularly. Okay. So Uttravasti, this course is going to be of utmost use to you if you are going to attend this. Benefit from this. This is what I would like to tell you. Thank you, Pradigna, for giving me this opportunity to introduce Uttravasti to all the students. Thank you all for your patient listening.
Thank you, Dr. Bharat. Thank you for that. Thank you, Dr. Pratibha. Let us now just go through what are the courses and the course contents. And I'll just give you a very basic idea about what is going to happen. Will be Dr. Pratibha will be taking the introduction classification of Uttravasti in females and the practical application of that. Dr. Bharat will be taking care of the Uttravasti in males for our program. And as I told you before, the program is going to start on the 6th of January. We'll be having it in the evening, and all the details of the program will be given in the chat. The Dr. Rahul is posting some links for a WhatsApp chat. If you are joining that, you will get all the details of this course or this program in that chat later on. You can please send that to your friends and colleagues who are interested in this speciality, and they'll also be able to benefit from this. And as Dr. Bharat said, you need to specialize. There is a saying that specific is terrific, right? So that is the reason we specialize. And there are a lot of people who are treating a lot of diseases in our area. And if you can utilize this knowledge to develop your specialty in the field of gynecology or urinary diseases, then I'm very sure you'll have a bright future in this field. So these are the topics that we'll be covering in this course. And this is a number of if you are interested in contacting us, this is a number: Dr. Anjana Unnikrishnan, 9446967638, and Dr. Rahul, his number is 812-898-76622. Now we will be posting this video in the YouTube so that you can watch it again if you have missed any part of the this class, this introductory session. And you can please forward this to your friends who will be who will be able to listen to this and decide upon if they want to join this or not. The charge we are having for this session, for this class, is 999 rupees. That is for a 4-day class, and the videos will be available for you for this. We'll be also having a WhatsApp group for the people who will be joining us in this course. And this WhatsApp group will be having our teachers also inside there, and the students, the participants of this program will be able to ask questions to teachers through there. And we will keep the WhatsApp group for some time, so that when you start practicing, you need some hand holding, and this WhatsApp group will give you a little bit support for you to try this, because one time seeing and one time learning is not enough. You need to different cases will come, you will have multiple questions, you'll have different questions each time. And this is the place where you'll be able to clear your doubts. And in the future, we will be trying to have some support materials also for you in that group. So if you have any doubt, please do contact these numbers, please do write to us, and we'll be trying to help you. Just want to leave you with a thought: an investment in knowledge pays the best interest. So always keep trying to learn. These are my partners, Dr. Anjana Unnikrishnan, Dr. Rahul J, and myself. So I just want to say, keep learning, keep growing, and thank you all.